Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Welcome. This is Your World Today. I'm Kerrigan Von Poli.
My name is Ofelia de la Torre. So happy you can be with us today. And we're agreeing with envy too. Look at that.
We did very well coordinating today. I'm impressed with us.
You got the memo.
Well, we have a great show today, as always.
Yes, of course.
And our first guest is
Dr. Byron Williams. He's the infectious disease specialist at White Memorial Medical Center. In other words, the germ doctor.
I like the germ doctor.
I like that too.
Dr. Williams, welcome. Thank you so much for being with us today.
Thank you. Thank you both for having me.
Well, the first thing we're going to talk about today is an exciting new technology that White Memorial has, and I think it's called the Xenex Robot. Is that correct?
Yes, that is correct.
What is that, doctor? It has nothing to do with germs, right?
Well, it sounds space-age, doesn't
Yes.
It does.
The Xenex Robot is a new type of technology on the frontier of fighting hospital-acquired infections. A little background behind that. Hospital-acquired infections are responsible for a lot of the illnesses that we experience. In general, hospitals have been diligent to reduce them, but there's still bacteria or pathogens that are very resistant. And sometimes it's difficult for the housekeepers to clean the rooms to a complete standard. Enter the Xenex Robot. It's a technology where it uses ultraviolet light in pulses, and the light is so strong that it destroys or it zaps the bacteria.
That's amazing, doctor. Wow.
And so these are really tiny, tiny little germs, I would imagine.
Yes.
If we need light that needs to...
Doctor, I wish I had one of these little robots. When I had my baby, she's 13 years now, but I had a C-section.
Yes.
So when they opened, a bacteria came in and I got a cellulitis infection.
Yes.
And it was very, very tough. Had one of these little things been in there, we wouldn't have suffered so much.
Yes.
So this is what you're talking about.
Yes, and I'll go into a little bit more detail. Sometimes doorknobs or sink handles are not completely sterilized as best as we can get it. And so this robot takes that extra step in making sure the room is completely clean and completely safe.
Now, you mentioned ultraviolet light, and if light can kill germs, couldn't I just shine a flashlight in the room, or what's special about ultraviolet?
What is ultraviolet?
Yeah,
Well,
what does that make? What's the difference?
You know, not to get too complicated, certain types of lights have certain types of frequencies or potencies, if you will, and the intensity of the light is what destroys the pathogen or destroys the bacteria.
Okay.
So this one is ultraviolet light from xenon, and it is very strong, and it has a very appreciable effect of reducing or killing bacteria.
Now, is it harmful? I mean, if we were to stand next to it, would it hurt us?
Very good question. So once those robots go into the room, they go in there. It's an automated robot, so it goes in there by itself, and it's in there for about 5 minutes.
That's all it takes, doctor?
All it takes. That's all it takes. And you have to be out of the room because it can damage your eyes. The adverse reaction is the light is so intense that it can damage your eyesight.
So is it like a little explosion in the room, doctor, of light?
I guess that would be a good way to categorize it or characterize it. You know, I would probably call it a pulse.
So what does this technology mean for the medical world, doctor?
Well, as I alluded to earlier, it will make the hospital safer. You know, if we can get to a point where you're not exposed to what you told me you were exposed when you had the C-section, hospitals will just become that much more excellent in terms of quality and in terms of safety, in terms
Well,
of...
you know, I don't know the rest of the population, but I know that when I have to go see a sick person at the hospital, I kind of cringe because I know I'm going to go into a germ-infested place.
Right. I'll go into another aspect as well. There are more multi-drug resistant, what we call multi-drug resistant bacteria out there, and they come from various sources. And people can actually bring them into the hospital. So again, this robot, once a patient has left that room, goes in and takes that diligent step of completely sterilizing the room. So when the next patient comes in, we can be fairly well assured that they won't be exposed to any bacteria.
So if I go to White Memorial Medical Center,
Yes.
are there just going to be robots rolling around, or does it take a human to
Are they
operate
going
it
to zap
too?
us?
Yeah, there's some human collaboration,
Okay.
fortunately.
We're germ carriers too, and we're going to get zapped there.
Right. No, obviously there's human collaboration,
Okay.
but it is an automated process. So, and it is a process. It does not completely eliminate the need for environmental care or custodial workers, but it makes that job a little bit more perfect in terms of what we do to keep the hospital clean.
So can this branch out into maybe saving people from getting cancers and from inhaling these fumes and this sort of thing, Doctor?
Well, it's a new technology, but as we get more into it and use it more, right now we're using it against certain, or I should say targeted resistant bacteria, such as Clostridium difficile, for instance, which is a very bad bacteria. But as we go along, we're probably going to be using it to see if it works against viruses. It has activity against viruses. And it's been formatted and it's been displayed at some of the most prestigious infection control forums.
Are you pretty excited about this technology?
I'm very excited about it. I am very excited about it.
Well,
All right.
this is something we're going to talk a little bit more right after the break. Stay
Yeah.
with us.
Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions.
We invite you to come and visit our Community Information Center at White Memorial and let us help you.
Tired of your current job? You've been laid off for a longer period of time because you may lack the necessary professional skills that employers are looking for today? Don't be another unemployment statistic and arm yourself with the tools of knowledge. Call the number on the screen now. NP College can fully train you in a wide variety of healthcare, business, and general legal fields in just a few months. Call now or visit us at www.npcollege.edu. NP College, where a better future begins.
The Martinez family is about to change. Mariana passed her driver license test and the family has been budgeting for a new car. That's why they trust in the SCE Credit Union See You at the Wheel auto buying program. Saving time and money with concierge level service, delivering the exact car her family selected without going to a dealership, and they get a great rate on their auto loan. SCE Federal Credit Union has been helping families finance their dreams since 1952.
It's such a step forward for the community that White Memorial has gone through the time and the expense of purchasing 3 of these machines that will combat surgical site infections, will combat C. diff, will just act as that over-the-top disinfecting system that's really going to make a difference in the hospital, with the patients, with the staff, and with the community.
I feel very relieved and very secure for the patient and for all the infections that we can discontrol from it.
Welcome back. We're going to continue our conversation with Dr. Byron Williams from White Memorial Medical Center.
The germ doctor.
talking about the Xenex Robot.
How are they built? What technology is used?
It's basically an automated,
I mean, is this like
Yeah.
NASA technology? What are we talking about?
I don't know if I would go as far as saying it's NASA technology. You know, automated technology, I think, has been a topic of research for many years, and I think it's safe to say we're in the generation now where we're seeing a lot of automated technologies. You've seen where now cars are parking themselves.
Yes.
They're almost going to drive themselves. soon.
I
Yeah,
know.
I think I saw the other day, they actually showed a car moving on its own.
Well, look at
So,
Siri, doctor.
That's correct, yeah.
It's kind of scary. Anyway.
So this is something on that frontier of technology. It's automated, it's a robot.
Expensive?
I presume it is expensive. And, but you cover that cost later. You know, the benefits in terms of what it costs are manifested several-fold, I think, in the end.
Doctor, these little guys, can they help eradicate situations like the Ebola crisis?
Yes, they're supposed to work on viruses. You know, so that remains to be seen. But the science is there for it to do it. Theoretically, it should be able to do it, and obviously it would be a very big boon to us, you know, should we have another big Ebola outbreak.
That's
Yeah.
huge.
It
That's
is.
really
It's a
big.
big deal.
Now,
That's right.
you mentioned the automation. What is the human factor in it? How, as far as operating the system, what do humans need to do to?
Humans need to maintain the robot, basically. Program the robot, maintain the robot, and make sure it's working up to standard. And that's pretty much it, much like a computer.
So once it goes into a room, it's on its own and it knows what to do by itself?
Yes,
Yeah.
that is correct.
And in the hospital itself, are these in the operating theater, the patient's rooms, labor delivery, hallways? Where are they going to be in use?
So in different hospitals, they've been assigned to piloted areas, areas where the infection rate is high, where the surveillance of infections are high. That can be either a hospital ward, it can be an operating theater, it can be a labor and delivery room.
Doctor, if my son or my daughter have their immune system is compromised and they have these, I don't know, there's so many diseases out there, and I need to keep them away from germs, could I feasibly buy one of these and have it at home and like protect them? In the future, of course.
You know, that would be a wonderful thing to ponder, and I think eventually the manufacturers would probably
Be happy to oblige.
to oblige that. I don't see why. I think, you know, we need to work out all of the adverse potential reactions to it, but they seem to be small, and they seem to be related to eyesight exposure.
And just so we're clear, and everybody at home is clear too, is this something that will kill viruses or just, you know, help fight against them a little bit?
No, this kills viruses,
So it wipes it out.
bacteria, you know, what the class of infectious agents we call pathogens.
And this is an important technology. I'm sure it's in a lot of hospitals now, or are there only a few that have it?
So there are only a few that have it right now. You know, it's just coming out. It's a relatively new technology, and hospitals are now taking it. They're surveying, they're collecting data to see how efficient it is. And so, you know, we should have numbers back in the next year or so. And in some places, there are already numbers.
So it's at testing stage, doctor?
I would say it's at it started its testing stage, and it's just being applied to the working or work site milieu.
And how much of a big deal is it that White Memorial Medical Center in Boyle Heights has this technology?
Well, you know, that makes me want to brag. It's a very big deal. You know, we're very happy to have that. It's very good to be on the forefront of such a technology.
Always innovating.
Always innovating, and it makes us very proud as an institution to be on the forefront of something like this.
Well, if you tell me what hospital I want to go to, I want to go to a germ-free hospital.
Absolutely.
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 Thank
well,
you.
Dr. Williams, we're so thankful that you
Yes, we are.
came and shared with us and told us about this really exciting technology.
God, yes. Thank you so much, Doctor. Well, now you know what to look for next time you get sick. We're going to go to a commercial break. We'll be right back. Don't go anywhere.
Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions. We invite you to come and visit our Community Information Center at White Memorial and let us help you.
Tired of your current job? You've been laid off for a longer period of time because you may lack the necessary professional skills that employers are looking for today? Don't be another unemployment statistic and arm yourself with the tools of knowledge. Call the number on the screen now. NP College can fully train you in a wide variety of healthcare, business, and general legal fields in just a few months. Call now or visit us at www.npcollege.edu. NP College, where a better future begins.
The Martinez family is about to change. Mariana passed her driver license test and the family has been budgeting for a new car. That's why they trust in the SCE Credit Union See You at the Wheel auto buying program. Saving time and money with concierge level service, delivering the exact car her family selected without going to a dealership, and they get a great rate on their auto loan. SCE Federal Credit Union has been helping families finance their dreams since 1952.
This segment is brought to you by Southern California Edison Federal Credit Union.
Welcome back, folks. This is Your World Today. I'm so excited with my next guest. Her name is Shannon Furiani. She's Vice President of Lending at SCE Federal Credit Union and lending, purchasing a home. Shannon, welcome to the show.
Thank you.
The American dream. I love to buy homes. Not that I have so many, but I have my home. And this is something we all dream of. You know, we get married and we really look at that dream.
Right.
And you guys make it possible.
We do, we do.
So what do we do before we go to the first open house?
Well, as you mentioned, everybody wants to buy a home, and it's the largest purchase you'll probably make in your lifetime. So you want to go into it prepared, and you want to know the area that you're looking to live in and drive through it during the day and at nighttime. It makes a big difference.
Shannon, I never thought about driving through that neighborhood at night. That's a really good advice. What else can we think of to make sure we're doing the right choice?
Mm-hmm. Just know your budget, know what you can afford, and go into it prepared. Get pre-approved. Make sure you've connected with a good realtor and a good lender that's looking out for your best interest.
Tell us what lenders are looking at when qualifying us for a loan.
They're going to look at your credit history, they're going to look at your job stability, your income, and a down payment if you have one if it's a purchase.
So if I get pre-approved for a larger amount than what I need, do I have to spend the whole amount?
No, not at all. In fact, it's better to have been pre-approved for more so that when you're out there shopping, if you find a home that you're interested in, you're going to be more likely to be able to make that offer, and your offer may be accepted over someone else's because you've been pre-approved for more than you may need.
What if, on the contrary, I don't get approved for my dream home? What do I do then?
Well, it could be it's just not the right time for you to buy, and there's alternatives, ways for you to get better prepared. You can use our credit counseling service at SCE Federal Credit Union. We have a free counseling service. They can help you with budgeting, planning for your purchase, get you prepared and in a position where you would be likely to buy that home.
And you offer that free of charge at the credit union?
Yes, we do. Our counseling service is free of charge for all of our members.
What are the different types of home loans?
The most common are conventional, jumbo, FHA, and VA. They all have different requirements based on the type of loan program, but that's beneficial depending on your needs. You can be placed in a program that fits your requirements.
Shannon, if I already own my home, shall I refinance it?
You could if you're at a higher interest rate, or if you're at a point where you want to pull some money out. If you have equity in your home, you can utilize that equity for other things, improvements, education, a variety of things. And it might be a way for you to lower your interest rate too.
When do I know it's the right time for me to refinance my home?
It's good to keep an eye on rates. That's the most critical thing. There are programs such as Rate Watch. SCE Federal Credit Union has that service. It's free. You can sign up for Rate Watch where you can monitor rates, and when they get to the point where it's a rate level that you like, that you want to refi, you can act on it quickly because you've been notified.
What are some of the items I should be aware of when refinancing my home, like for example, points and interest rates?
All loans have fees associated with them in some way or another, and a point, for example, is a cost associated with the interest rate. It's 1% of the loan amount, and based on what you're looking to do in terms of getting a lower rate or even paying a higher rate, the point structure can change to give you credits if you need them.
Well, I don't know a whole lot about financing, but I do know that I don't want to pay higher rates. Why would anyone want to pay a higher rate on their mortgage?
Sometimes it makes sense because in a transaction like that, you might get a credit or a rebate back that can cover your closing costs, where you may not have any at all out-of-pocket expense. You're paying a slightly higher interest rate, but you have no expense of your own.
There's so many lenders out there. How would I know which one is the right one for me?
There are a lot of lenders that offer home loans, and it's really finding the right one that's going to look out for your best interest, who is going to be honest and help you through the process. There's a lot involved in a home loan. There's a lot of paperwork involved, so it makes a difference who you work with. And SCE Federal Credit Union is there for our members every step of the way.
What about coming in, Shannon, and sitting with you or someone at your office to explain the process of purchasing a home? Is that available?
Absolutely. We have counselors that can provide some advice and suggestions on what to do to get ready, how to position yourself, and we can connect you with the right realtor, and of course, we're the right lender.
And I should go with a credit union versus a bank because?
Well, credit unions are probably going to be a little more attentive to your needs, and we're there for you. We'll assist you with all your questions. Any area you need assistance with, we'll be there for you.
Thank you so much, Shannon.
Thank you.
And thank you for being with us. We're going to go to a short break, but we'll be right back, folks. Don't go anywhere. I'm going to stay here with Shannon.
This segment was brought to you by Southern California Edison Federal Credit Union.
The Martinez family is about to change. Mariana passed her driver license test, and the family has been budgeting for a new car. That's why they trust in the SCE Credit Union See You at the Wheel auto buying program, saving time and money with concierge-level service, delivering the exact car her family selected without going to a dealership, and they get a great rate on their auto loan. SCE Federal Credit Union has been helping families finance their dreams since 1952.
Tired of your current job? You've been laid off for a longer period of time because you may lack the necessary professional skills that employers are looking for today? Don't be another unemployment statistic and arm yourself with the tools of knowledge. Call the number on the screen now. NP College can fully train you in a wide variety of healthcare, business, and general legal fields in just a few months. Call now or visit us at www.npcollege.edu. NP College, where a better future begins.
Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions. We invite you to come and visit our Community Information Center at White Memorial and let us help you.
Welcome back. This is Your World Today.
We're here with Charles Mugrdechian from NP College. How did I do with your last name?
You did a great job, thank you.
Thank you, Charles. I love Charles, but his last name, boy.
That's okay. Once you know it, you remember it.
That's right.
So we're going to talk to NP College today and Charles about some medical careers
Yes, I think it's very important that whether you have a job now in the medical field or you're right out of high school or you're looking to change your career, sometimes people need to take some time figuring out what medical field they want to get into. And we have some short programs that helps people get into a job opportunity a little faster. We have a phlebotomy technician program, which only takes 5 weeks to complete. It's weekends actually, so you could be working and
Really?
Yeah, and then you have a hemodialysis program, once again weekends, and that takes 15 weeks.
Let me interrupt you. What's hemodialysis?
Anybody who has kidney failure and has to go through a dialysis process, whether it's daily or weekly or how often they do their dialysis, the technician is the one who will be assisting the patient, working with the equipment, and all the facets that go with that process.
And a lot of sick people that need dialysis
Yeah, absolutely.
as well.
And it's absolutely, and it's important that whether you're in the medical field already, you may want to add those types of training so you can improve your employment opportunities, whether it's at a hospital or other facilities.
So Charles, it seems to me that you guys have like a cluster of careers in the medical field, and with the baby boomers retiring and getting sick as well. Is that kind of
Yeah,
ties
and
into-
I think that's well known in the industry that medical field is always a good field to get a job into. Some people can't handle blood or needles, but there are other types of programs that we teach or that are taught out there, such as MRI technologists, diagnostic medical sonography. You know, you're dealing with patients, but you're not with needles and blood, whereas medical assistant or phlebotomy and hemodialysis, you do deal with the
But
injections.
it's a good career because, you know, there's more people, there's more illnesses, more need.
And it is a great career, but I'm wondering out there, what age of the people watching? Does it have to be the teenagers,
Good
adults?
point.
Who
That's
can
a
do
good
it?
point, yeah. And we build all of our programs so that you can have zero knowledge in the medical field and start from scratch. And we work with the students week by week, month by month, throughout the training, so they slowly improve their knowledge in the medical field.
Do I need a previous background in, say, biology or science?
No,
or-
not at all. That, like I said, we want to make sure everybody has an opportunity, and that's what our vocational training is all about, and that is step-by-step fundamentals and into a career path that you can be successful in.
So no previous prerequisites of any kind? Nothing
Not at
special?
all. High school diploma, GED is recommended. There are some programs that you don't have to have the high school diploma or GED, that you need to be an ability to benefit test to complete. But for the most part, if you don't have a high school diploma or GED, there are opportunities that we can help you with to get your diploma or your GED.
Charles, thank you for the information. I know you guys also offer financial assistance to people that qualify, so you're a well-rounded program. Thank you
Absolutely.
for coming on the show.
Appreciate the opportunity. Thank you.
All right.
Well, that's it for us today.
That's
Another
it.
great show.
Another fabulous show. What are you talking about?
Learned lots, and we want to make sure that people visit our
Yes.
website at yourworldtoday.tv. Find information about us, upcoming shows, past shows.
We're so proud of our website.
It's all there.
Videos, you want to see the interview again, well, look it up. So now you know.
This
Thanks
is-
for watching.
This is Your World Today. Thank you.
Bye-bye.